Hello there, I'm Kate Walsh. I'm here today with Dr. Alastair Bell, Executive Vice President of our BMC Health System. Alastair, when we spoke last, you talked about the modeling and planning that we'd done based on what we'd learned from other countries around the world who faced this pandemic. So now we're into this about a month. What changed in our assumptions? What surprised you? And how is BMC responding?
So about a month ago, we made a plan to almost double to triple our capacity, both on med-surg and ICU, to look after patients. I would say in the intervening time since then, three things have been kept us on our toes as the epidemic evolved. The first is the actual underlying modeling based on external sources and assumptions has actually changed pretty dramatically. So what we've been trying to do is update that. Initially, we thought the peak of cases would be further out. It now seems to be much sooner. The second thing is our modeling obviously made assumptions around staffing relative to patient acuity. What we found is actually these patients are much more acute than we thought. We are having much bigger surge in ICU beds than sort of standard med-surg beds. And the patients in our ICUs are requiring more one-on-one care from nursing rather than 2-to-1. And so that's what we've had to sort of adjust our nurse staffing assumptions alongside that. I would say the last thing, and this probably relates mostly to the personal protective equipment, is an evolving understanding of the disease and how we could prevent it spreading. So, for example, when we began this journey, the advice was that, in general, people should not be wearing masks. And now we're receiving guidance that actually everyone in the country should be wearing a mask. And so adjusting that and evolving our policies as we go along, and then how that intersects with our supply chain has been actually a pretty big challenge.
And as we move forward, we'll continue to evolve. So one of the things that struck me as I've been leading us through this effort is really just the creativity and flexibility of the team here at Boston Medical Center. I mean, there were days when we would issue 2 or 3 different sets of guidance around PPE. Could you talk a little bit about what that was like, how it disrupted the work we were doing, disrupted the supply chain, and how we responded as a team?
Yeah, I think it really it shows how we have come together as a team, because it's really very difficult when you change guidance on a day-to-day basis. You're trying to maintain trust in staff that we're giving good advice and good guidance to keep them safe. People have been very accepting of changes, which is really very appreciated. I think within, say, for example, the supply chain, people have been very creative around alternative types of equipment that we could use, some pretty interesting and creative approaches, let's say. And so people have really kind of come together to actually try to solve this problem as it has emerged in front of us.
Safe to say that at Boston Medical Center, we move mountains pretty much every day.
That's right.
Thanks, Alastair.
Thank you.
And thank you for tuning in.